Hey, you. Ever really thought about what happens, after a kid's tooth comes out?
It seems pretty straightforward, right? Tooth falls out, new one comes in.
Yeah, but today we're taking a deep dive into something that actually has a pretty big impact later on. What happens when baby teeth leave a bit too early?
And crucially, how we manage that space for the permanent teeth coming in.
Exactly. Think of this as avoiding future dental headaches, maybe even braces for your kids.
We've been looking at some really good material. There's a detailed video lecture on space management in pediatric dentistry
Oh, yeah.
and a PDF that goes with it. Proper professional stuff. It really breaks down the why and the how.
Good. So our mission here is pretty simple, really. We want to give you a clear picture of why losing those baby teeth early is, well, kind of a bigger deal than you might think.
And what dentists can actually do about it to keep things on track for a healthy smile, cutting through the confusion.
Right. So let's kick things off. We know baby teeth are for chewing, maybe talking.
Sure, the basics,
Right.
but their job is much bigger than that, isn't it?
Definitely. You could almost call them placeholders. Or maybe like a blueprint for the adult teeth waiting underneath.
That's a great analogy, a blueprint. They literally reserve the right amount of space. They're gatekeepers, making sure there's room.
So when we say premature loss, what exactly does that mean in practical terms?
Good question. It means a baby tooth falling out way earlier than it's supposed to. So like a lower baby molar. That should hang around till age 9, 10, maybe 11.
Right.
If that falls out when the child is 6 or 7, that's premature loss, a significant gap in timing.
Okay, so let's unpack that. What happens when a placeholder goes missing too soon? What are the ripple effects?
Well, the biggest, most immediate thing is space deficiency. You lose that tooth, you lose arch length, the overall space shrinks.
Like taking a brick out of an archway, the whole thing gets smaller.
Exactly. And less space means crowding. Permanent teeth trying to squeeze into a space that's just not big enough.
Misalignment.
Okay, crowding. That makes sense. What else?
Well, the teeth next to the gap start to take advantage. They drift. They tilt.
Ah, so they move into the empty space.
Precisely. The tooth behind leans forward. We call that mesial tipping. The tooth in front might lean backward, distal tipping.
So it messes up the whole row.
It really can. It disrupts the alignment, the bite, how the top and bottom teeth meet, the occlusion.
So it's not just about looking crooked then.
Not at all. Think about it, these new gaps and awkward angles.
Oh.
Perfect traps for food.
Oh, lovely. More risk of cavities.
Cavities, yeah, and gum disease, too. Those areas are harder to clean.
Great. One more thing to worry about.
And because the bite is off, you can get what's called traumatic occlusion, teeth hitting wrong.
Like uneven pressure.
Exactly, which leads to abnormal wear on the teeth and potentially even TMJ problems, jaw joint issues.
Jaw problems in kids from losing a baby tooth early.
It's possible. You'd be surprised how hard kids can clench, even subconsciously. If the bite's off, it puts strain on the system.
Huh. Never would have connected those dots.
And there's more. If it's front teeth lost early, it can sometimes affect chewing efficiency.
Makes sense. And maybe even speech development in some cases.
Wow, okay, so crowding, drifting, cavities, bite issues, maybe even jaw and speech problems. That's quite a list. Any other surprises?
Oh, here's a really interesting one. The timing of the permanent tooth coming in. It's a bit weird.
Weird how?
Losing a baby tooth really early, like say a molar at age 4, it can actually delay the permanent tooth coming in, maybe by up to a year.
Wait, delay it. I'd assume the opposite, like the path is clear, come on through.
That's what most people think. But the theory is the root of the baby tooth might help guide the permanent one. Root's gone too early. The permanent tooth takes longer finding its way through the bone. But, and this is the paradox, if the baby tooth is lost closer to its natural leaving time, say within 6-12 months, then it might speed things up because the permanent tooth doesn't have to wait for the baby root to dissolve.
Fascinating. So super early loss equals delay. Loss closer to time equals maybe faster. That's definitely counterintuitive.
It is. And then there's the bone itself. Baby teeth help stimulate the jawbone. Lose them early, you can get less bone height and width in that area.
Which could cause problems later. For braces or implants, maybe.
Potentially, yes. It can complicate future treatments if the bone foundation isn't as robust.
And I guess on top of all that, there's the kid's feelings, right? Especially with front teeth missing.
Absolutely. The psychological side is real. Kids can be self-conscious about missing teeth, especially if it happens much earlier than their friends.
Okay, it's crystal clear. This is something to pay attention to. So let's get into the nitty-gritty. How does the space actually close up?
Right. So after a baby molar goes early, Space loss is almost guaranteed to some degree. It's mainly the permanent molars behind the gap. They just naturally want to drift forward.
They drift forward into the space.
Yep. And in the lower jaw, sometimes the front teeth can also drift backward a bit, squeezing the space from both ends.
And this isn't just a tiny shift, is it? I remember the sources mentioning some pretty big numbers.
Oh, yeah. It can be quite shocking, actually. For upper second baby molars, you could lose up to 8 millimeters of space per side.
8 millimeters. That's huge in a child's mouth.
It is. And lower second baby molars, maybe up to 4 millimeters per side. Similar amounts for the first baby molars, too. It really adds up.
Wow. That definitely puts the risk of future crowding into perspective.
And the scary part, most of this space loss happens fast, usually within the first 6 months after the tooth comes out.
6 months. So you don't have long to act.
Not really, and it can be worse if other permanent teeth are actively erupting nearby.
How so?
Well, say you lose the lower first baby molar, the D, right when the big permanent 6-year molar, the 6-foot, is coming in behind the second baby molar, the E.
Okay.
The force of that erupting 6-foot can push the E forward into the gap left by the D, stealing space even faster.
Like a domino effect triggered by the erupting tooth.
Kind of, yeah. And
Right.
how the space closes differs a bit, top versus bottom. Upper
Yeah.
jaw, the big molar tends to move forward more bodily, maybe rotates a bit. Lower jaw, it's often more of the molar tipping forward and those front teeth tipping backward, which can make an overbite worse sometimes.
Interesting mechanical differences. Okay,
Yeah.
let's circle back to the eruption timing. We know early loss can cause delays. Can we be more specific?
Generally, yes. Losing a primary molar before age 7 often means a delay for the permanent tooth underneath.
And the earlier the loss?
The longer the likely delay. So loss at age 4, maybe up to a year's delay. Loss at age 6, maybe closer to 6 months delay on average.
So age 7 is kind of a rough turning point.
It seems to be, yeah. But remember the flip side. Lose it within, say, 6 to 12 months of when it should fall out naturally, and the permanent tooth might pop through a bit faster.
Right, the paradox.
But it's not always simple. Sometimes permanent teeth get delayed for other reasons. They get stuck, impacted, or they're just heading in the wrong direction.
Okay. So what happens then?
Then the priority isn't just when it erupts, but making sure it ends up in the right place with enough space. We might need other interventions later to guide it.
So eruption timing is complex. What else affects how quickly that permanent tooth comes through?
Bone density is a big one. How much bone is covering the permanent tooth?
Less bone means faster eruption.
Generally, yeah. More bone means slower. It takes about 4 to 6 months for a tooth to erupt through just 1 millimeter of bone.
1 millimeter takes 46 months. Wow.
And that directly influences the decision about needing a space maintainer.
How so? Tell me more about that connection.
Okay, so if a baby tooth is lost, but it's pretty close to the normal time, the dentist takes an x-ray. If that x-ray shows there's less than, say, 1 millimeter of bone over the permanent tooth,
Just a thin layer.
right, then a space maintainer might not be needed. The thinking is the permanent tooth will likely come through relatively soon before significant space loss happens.
Okay.
But Z, if there's more than 1 millimeter of bone on that x-ray, then a space maintainer is usually recommended.
Because it might take a while for the tooth to erupt.
Exactly, and we know most space loss happens in those first 6 months. So if the tooth has further to travel, there's a high risk of the space closing up before it gets there.
That makes perfect sense. It's a calculation of risk based on time and bone coverage.
Yeah.
Are there other things that make space loss worse?
Yeah, a couple of things. Strong chin muscle activity. The mentalis muscle in the lower jaw can sometimes push the front teeth back if posterior teeth are lost.
Really? Muscle activity.
Yeah. And habits like thumb sucking or finger sucking, those can definitely move teeth around and worsen space loss.
So breaking those habits is important too. Okay, before we even get to fixing the space, you mentioned x-rays. Sounds critical.
Absolutely non-negotiable. Before pulling any primary tooth, you have to take an x-ray. Why?
Tell me.
To make sure the permanent tooth is actually there.
You mean sometimes it isn't?
Yep. It's called being congenitally missing. Especially common for lower premolars, the ones that replace the baby molars. They just never developed.
Wow. So you could be holding space for a tooth that's never coming.
Exactly. And if that's the case, the whole game plan changes. Maybe you try to keep the baby tooth longer. Maybe you let the space close partially for a future implant or bridge. Maybe orthodontics. You need that x-ray info first.
Okay, point taken. X-ray first, always. So, assuming the permanent tooth IS there, and space loss is a risk, let's talk solutions. Space maintainers to the rescue.
That's the idea. They're appliances, basically, designed to hold that empty space open, keep the neighbors from moving in.
Okay.
Their job is just to make sure there's enough room for the permanent tooth when it's ready to erupt correctly. We can sort of group them based on if it's one missing tooth or several.
Makes sense. Let's start with just one missing baby molar. What's the go-to?
Most common is the band and loop. You put a metal band, like an orthodontic band, around a tooth next to the gap.
Okay.
And attached to that band is a wire loop that just spans the gap. It physically stops the other teeth from drifting into that space. Simple, usually pretty unheard. The wire's a specific thickness, like 0.036 or 0.040 inches, for strength.
Got it. Band and loop. What if the tooth you need to put the band on, the anchor tooth, isn't very healthy? Like it has a big filling or needed baby root canal.
Good point. If that anchor tooth needs a crown anyway, like a stainless steel crown after a pulpotomy or pulpectomy,
The baby root canal type things.
yeah, then you can use a crown and loop. Basically, the loop wire is attached directly to the crown before it's cemented on the tooth. So you fix the anchor tooth and hold the space all in one go.
Smart. Two birds, one stone.
Yeah.
Now, what about that tricky situation you mentioned earlier? Losing the second baby molar before the first permanent molar comes in, around age 6 or 7.
Ah, yes. That's where the distal shoe comes in. It's really critical here
Why shoe?
because it has this metal extension, the shoe, that actually goes under the gum just slightly. It sits right where the incoming permanent molar needs to be guided.
Under the gum. Wow.
Yeah. It's usually attached to a band on the first baby molar. As that big permanent molar erupts, the shoe guides it, preventing it from drifting forward into the space where the second premolar needs to go later. It's essential for preventing impaction sometimes.
That sounds quite technique sensitive. Needs to be placed just right.
Very much so. Okay, so that's single teeth. What if multiple baby teeth are lost early?
Right. Different ballgame. Does it differ top versus bottom jaw?
It can, yeah. Let's start with the lower jaw. If multiple baby teeth are gone and the permanent front teeth, the incisors, are already erupted,
Okay. Condition noted.
then a common choice is the lingual holding arch. You put bands on the permanent first molars, the sixes, on both sides.
Right.
And then a wire runs along the inside the tongue side or lingual side of the lower front teeth, connecting those bands. It holds the molars back and maintains the space further back.
So it uses the front teeth as part of the anchor.
Essentially, yes, they provide stability.
Right.
Which leads to the next question. What if those permanent front teeth haven't erupted yet, but multiple lower baby teeth are gone?
Yeah. What then?
Well, it's less ideal. You might end up using multiple band and loop appliances, one for each missing tooth space.
Sort of a temporary fix?
Kind of. It helps preserve some space, but it's not as robust as the lingual arch. Maybe you'd transition to a lingual arch later once those front teeth are in.
Okay. Got it. Now what about the upper arch? Multiple missing teeth up top.
Two main players here usually used once the permanent first molars are in. The Nance appliance is one.
Nance.
Yep. Again, bands on the upper permanent first molars. A wire then runs across the palate, the roof of the mouth,
Okay.
and it has this little acrylic button that rests gently against the front part of the palate. That button gives it extra support to stop the molars drifting forward.
Acrylic button on the roof of the mouth. Interesting. What's the other option?
The other common one is the transpalatal arch, or TPA. Also uses bands on the molars, also has a wire across the palate.
So similar to the Nance.
Similar structure, but the TPA, at least as described here for space maintenance, is often more about controlling the molars themselves, stopping them rotating or moving sideways, rather than actively holding space further forward like the Nance with its button does.
Ah, so slightly different primary jobs, even though they look similar?
Can be, yeah. But both the Nance and the TPA rely on having those permanent first molars erupted to anchor onto. That's key.
Okay, quick recap then. Single tooth loss, band and loop or crown and loop if the neighbor needs work,
Hmm?
or the special distal shoe if the second baby molar is lost before the permanent molar erupts.
Got it.
Multiple tooth loss, lower jaw after front teeth are in. Lingual holding arch before front teeth, maybe multiple band and loops,
Yeah.
multiple tooth loss, upper jaw after permanent molars are in. Nance appliance, often with a button, or a transpalatal arch, maybe more for molar control.
You've nailed the main ones. And the core idea behind all of them.
Preserve that space.
Exactly. Let the permanent teeth come in where they're supposed to, hopefully leading to a healthy, well-aligned bite without needing major correction later.
This has been Wow, really informative. It's kind of amazing how much those little baby teeth are actually doing behind the scenes.
Isn't it? Losing them early isn't just a gap in the smile. It can really set off this chain reaction affecting how the whole permanent set develops.
But knowing about it
Yeah.
and knowing these space maintainer options exist empowers parents,
Yeah.
right, to work with their dentist.
Absolutely. It's all about proactive management for the best long-term outcome. Healthy smiles.
Thinking about how intricately baby teeth guide the permanent ones,
Hmm.
it does make you wonder, doesn't it? What other seemingly small things in childhood have these big long-term ripple effects on health?
That's a really deep question to chew on. The interconnectedness of development, it's fascinating.
Yeah.
And speaking of childhood development in a dental context, maybe for our next deep dive, we could explore something like kids' behavior in the dental chair and how dentists manage anxiety without just resorting to medications.
Oh, non-pharmacological management. That sounds really interesting. Definitely something parents would want to know about.
Could be useful.
Okay, well, that's one for the future then. For today, thanks so much for breaking all this down. Super helpful.
My pleasure. Always good to talk teeth.
And to you, our listener, thanks for tuning in for this deep dive into space management. We really appreciate you being here. Until next time, take care.